That's fucking hilarious. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a damn arms race. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a goddamn arms race. This ain't a scene. It's a goddamn arms race. Like a headphone stand or something. But anyway, this ain't a scene. It's a goddamn arms race. This ain't a scene. It's
gonna be really tough to.
Let me try that. Hold up. Hold the fucking phone. Hold up. Let me get it started. BB with the Robins. Looking all, what? BB sagging, fly like a dragon. What? Something like, what? Because I'm fly like a dragon. Let's watch the LCS while I'm doing this shit. Fucking co-stream. Yeah. Let's get that shit going. Let me full screen this bitch. Full screen. Get the chat. I don't give a fuck about chat. No one has anything good to say. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a goddamn arms race. This ain't a scene, it's a goddamn arms race. Is this like illegal? I hope not. But I guess I'll say. Alright. Let's fucking see. Where did I leave off before I decided to do this? I left off. Let me open this. My non-alcoholic IPA. We don't be drinking up in here, but we pretend to be drinking up in here. We pretend. Because we can't do it anymore. Because we get out of hand. And we go a little crazy. And we do it a little too much. So we don't do it anymore. Cloud9's beating FlyQuest. Fuck. Anyway. Thrush. Thrush is an infection caused by the yeast Candida albicans or other fungus in the Candida family. The infection causes cream-colored or white patches or lesions on the tongue, mouth, or pharynx surrounded by erythema. Persons at high risk for candidiasis include premature neonates, older adults, immunosuppressed persons, persons with diabetes, persons taking antibiotics, persons taking steroids for a long time, and persons with conditions that cause hyposalivation, especially inhaled corticosteroids. For infants with thrush, the oral mucosa is swabbed with nystatin between feedings. However, feedings can wash away medication. Nursing mothers should also be treated to avoid reinfection and co-infection. Infants who are 6 months or older Infants who are 6 months older or older may be prescribed oral fluconazole. Older children and adults may rinse with and swallow antifungal solutions for treatment. Oral or intravenous medications such as fluconazole or clotrimazole may be necessary in more severe cases. Good oral hygiene is crucial for preventing and treating candidiasis. Amen, brother. Case study 1. Yeah, this looks like a Cloud9 win to me. Sherry is a 45-year-old manager of a busy, upscale women's boutique. She attends many social events related to business and drinks about 2 or 3 glasses of wine per day. Sherry smokes half a pack of cigarettes daily and loves to lay out in the sun and visit tanning beds in her spare time. About a month ago, she noticed a painless white patch about 1 centimeter in diameter on the inside of her left cheek. Because it was not causing any discomfort, Sherry dismissed it as unimportant. Today she visited her dentist for her regular 6-month checkup. The dentist expressed concern and recommended that she have her family doctor evaluate the white patch. A biopsy indicated that Sherry has oral cancer. That's right, Sherry. You have motherfucking cancer, alright? Here we go. Whoa, notes should be up here. Can I just minimize notes and it goes away? Alright, good. Alright, so Sherry's got fucking cancer, dude. That's what happens. So, the question that we're asking ourselves right now is Sherry has all of the following risk factors for the development of oral cancer, except what? Well, we got fucking A, which is stressful work environment, which feels like a trick. That feels like a trick. B, tobacco use. I don't remember her saying that she smokes. Oh, half a pack of cigarettes. Yeah, so she definitely got that. C, regular alcohol consumption. And motherfucking D, which is exposure to UV rays. Now, she says it's a busy upscale. I feel it's probably A, but that feels like a trick question. Because it's going to be like, oh, stress is like the #1 cause of cancer. No. Well, it's mouth cancer. So she got the alcohol. She got the motherfucking fucking smoking. And now she's got the exposure to UV rays, which is like, duh. Stress can also add. However, yeah, we're gonna fucking say A. Can I get a highlighter up in this shit? What if I do this? Format, view, help. Can I insert, motherfucker? It's just notes. I can do anything. Can I like underline? Can I like bold? Can I like control B? Can I control B? I can't. I fucking can't. What's the point? What's the point of you, notepad? Just to take notes? Well, it's motherfucking this one. I'm just gonna do fucking... It's fucking this one. I can't even do a check, bro. Can I do a dot? Can I do a dash? I'll do this. Like a boop. That's control. Whoops. Do that. That's our pick. This one. Do a bunch of them. This is what we're choosing. Anyway. Get this out of here. Watch some LCS. Oh, but wait a tick. Wait a singular tick. Content. This is content. You know, I was reading this out loud to... Steve, I was reading this out loud to myself anyway. And I was like, you know what? Instead of being crazy in private, let me look like I'm doing this on purpose. So that's why. Okay. Anyway. So we're saying A. Sherry's story is not uncommon. Nearly 54,000 individuals in the U.S. receive a diagnosis of oral or pharyngeal cancer annually, and only 57%... Oh, let me circle it in here, too. So I'm not using red, because red is the color for corrections. Correct things in red. Cloud9's gonna win. RIP. I was enjoying the fall of C9, like how I enjoy the fall of TSM. Worldwide, this number is 657,000 new cases diagnosed yearly, which is likely an undercount as many countries do not have standard reporting systems. Oral cancer is not difficult to diagnose, but is often identified in later stages due to inconsistent screening processes for early diagnosis. It has spread by the onset of symptoms. Risk factors associated with the development of oral cancer includes use of tobacco products, including smokeless and chewing tobacco, exposure to radiation and sunlight, increases the risk for lip cancers, frequent alcohol ingestion, especially if also using tobacco products, infection with certain viral infections, HPV. HPV-16 has been linked to an increased number of oral cancer diagnoses. The Epstein-Barr virus and cytomegalovirus are also associated with developing oral cancer. Also, Steve, I said don't watch this. Why are you watching it? It literally says do not watch. Race, ethnicity is a risk factor. Oral cancer affects twice as many African Americans as whites. So oral cancer is fucking racist. That's another reason why we need to crack down on cancer, because if you read all the cancer studies, cancer is so fucking racist, dude. Cancer doesn't like African Americans. Historically, oral cancer occurred much more frequently in men, and it's fucking sexist too. Can we get more women to get cancer, please? Historically, oral cancer occurred much more frequently in men, affecting 6 men for every woman. However, the ratio has decreased to 2 men for every woman. That's what I'm talking about. It is believed that this is because of an increase in women who smoke and present with the HPV infection. Well, that is true. More women smoke now than they did before. And also, fun facts, they started giving the HPV vaccine to young boys because it has been discovered that when women get cervical cancer from HPV is because they got HPV from a man. HPV is transmitted male to female. That's pretty goated. Signs and symptoms of oral cancer include sores in the mouth or on the lip that does not heal within 14 days, white or red patch in the mouth, a lump or thickening in the mouth or on the lip, problems chewing and swallowing, trouble moving the jaw or tongue, pain in the mouth or lip, numbness in the mouth, loose teeth or dentures that become uncomfortable or start to fit poorly, changes in the quality of voice, swelling of the jaw or lips, visible masses or asymmetrical facial features, weight loss, fatigue, or anorexia. Nursing alert, wow, sound the alarms. Persons with an oral cancer diagnosis may need to undergo oral health procedures with their dentist or orthodontist to prevent complications after treatment, such as osteonecrosis and infection. This treatment includes cleaning and examination and may include tooth extraction if deficits like caries or cracks are present. Whatever the fuck a carie is. Anyway, the confirmation of the diagnosis of oral cancer may be accomplished through a number of diagnostic tests. However, the first step is a thorough physical examination. Gotta check out the feet to make sure the mouth's doing good. However, a biopsy of suspicious lesions is obtained to identify the presence of malignant cells. Other diagnostic testing may be helpful in diagnosis, including X-rays, pharyngoscopy or laryngoscopy, magnetic resonance imaging, MRI, computed tomography, CAT scan, CT scan, and positron emission tomography, PET scan. The prognosis depends on the location and staging of cancer in the oral cavity or oral pharyngeal area. The most common staging system for these types of cancers is the American Joint Committee on Cancer, TNM system, based on 3 pieces of information. Alright, you're going to want to write this part down. The extent of the tumor, which T, size of the primary tumor, and if it has spread to the surrounding tissue. The spread of the nearby lymph nodes, that's the N. If it has spread to the lymph nodes, how many, what size, and how large are they? Well, I feel like what size and how large they are is the same criteria, so I don't know why we have that twice. The spread, metastasis, to distant sites, that's the M. If cancer has spread to distant organs. The number or letters after T, N, and M provide more details about each factor. Higher number means the cancer is more advanced. The T category can be assigned a letter or a number. The TX means there's no information. TO means there's no evidence. TIS. T and then like lowercase is. TIS means that the cancer cells are only growing in the layer of the cells which they started, which the IS stands for in situ, because they are situated in one spot. They are in situ. A number after the T, such as T1, T2, T3, SK Telecom, T1, boy, T1, T2, T3, or T4 might describe the tumor size and or amount of spread into the nearby structures. The higher the T number, the fucking worse your case. The N category can be assigned a letter or a number as well. NX, again, no information. NO means nearby lymph nodes do not contain cancer. A number after the N, such as N1, 2, or 3, might describe the size, location, and or the number of nearby lymph nodes affected by cancer. The higher the N number, the greater the cancer. And the M category is assigned a number. M0 means no distant cancer, and M1 pretty much like did it spread, did it not? 0, 1. The treatment course depends on the cancer stage and other factors, such as the patient's age, overall physical strength, general health, and ability to tolerate the prescribed treatment. Treatment may include radiation therapy, surgery, chemotherapy, immunotherapy, or a combination of these. The 5-year survival rate is based on cancer staging, patient age, and the overall level of health, how cancer responds to treatment, and other factors. It's fucking hot in here. Oh, don't look. Don't look. Don't look. Don't look at me. Don't look at me. Don't look. Shut up. Fucking Caitlin Sweatshirt is here. Putting her shit on my shit. Putting her shit on my shit. Although I liked wearing the hood. I love wearing hoods. Alright. New chapter, disorders of the esophagus. The esophagus is a long, muscular tube. Your mom has a muscular tube. The esophagus is a long, muscular tube composed of 4 layers and connects the hypopharynx to the stomach. The layers of the esophagus are the mucosal layer, the submucosal layer, and the muscular layer, and the adventitial layer. The upper esophageal sphincter, UES, rests at the pharynx in the upper esophagus. It blocks air from entering the stomach and food from regurgitating into the airway. The lower esophageal sphincter, LES, located at the bottom of the esophagus, prevents the reflux of stomach contents back into the esophagus. Go figure. Shopify Rebellion beat Immortals? And then fucking Cloud9 beat FlyQuest. That's lame. NRG and TL, I feel like that could go either way. I would like NRG to win. And then honestly, 100 Thieves and Dig could go either way. But I would like... I kind of want Dignitas to win, to be honest. Anyway. Esophageal cancers. They're no good. Esophageal cancers are aggressive malignancies with a high mortality rate. Esophageal cancer accounts for 1% of all cancers diagnosed in the U.S. and has a 5-year survival rate. Wait a second. Is my microphone even hooked up to this? Does it need to be? Oh, it is. Okay, good. Let me... you know what I should do, actually? Now that I think about it. I'll have some sort of something. You know, some sort of something. Okay. Well, here's some evidence-based practice for you. The best kind of practice. Chronic gastroesophageal reflux disease can lead to Barrett's esophagus, where normal squamous cells of the esophagus are replaced with columnar cells. Research is being done at this time to identify which specific cells migrate to the site of the damage. Previously, it was thought that the cells developed into the wrong type, but recent research has noted that the changes may result from stem cells coming from the gastric mucosa and developing into columnar cells. Barrett's esophagus is highly associated with adenocarcinoma of the esophagus. Womp womp. Squamous cell carcinoma. Oh, sorry. New fucking chapter. Squamous cell carcinoma. Hog face. Squamous cell carcinoma occurs in the squamous cells that are located on the lining of the esophagus. The major risk factors for developing esophageal squamous cell carcinoma are cigarette smoking and chronic heavy alcohol consumption. No. You want cancer? If you want cancer, smoke some ciggies, dude. If you want to look cool, smoke some ciggies, dude. But being cool comes with a price. Here's a case study. Case study number 2, part 1. Pay attention. Lee is a 55-year-old man who arrived in the U.S. from Taiwan about 20 years ago. He is a heavy cigarette smoker, having smoked 2 packs per day for over 30 years. That's so much money. His wife tells him that his voice is different and hoarse. Lee also comments that he is having difficulty swallowing. These symptoms began several months ago and have been gradually but steadily worse. Lee decides to visit his doctor, who suspects an esophageal disorder. A biopsy of esophageal tissue confirms a malignancy. Biopsies fucking hurt. In case you're wondering. So, here's the self-assessment question number 2. This is where the content comes in. Sorry, you don't get to watch the team setup. So, we has reported swallowing difficulty. Idiot. Which recommendations does not have 2 C's.
Because we've got Callista, Ash, and Ivern all banned away at the start.
Yeah, and we have a really big game between Energy and TL here just because we had the 2-week break and Energy underperformed their
to address the issue. Alright, well, what do we got? We got motherfucking A, which is eat larger meals. No, absolutely not. Less frequent. It would be like small, frequent meals. Throughout the day? What the fuck? No. To prevent multiple pain episodes? Oh, maybe. Oops. No, that's what I didn't want. No.
And then those are a lot of times what you're going to pick early on blue side. So just having those gone very early from Energy.
And decrease the risk of choking? Choking? Why would he be choking? It's esophageal. There's a lower upper, I guess. Gargle with salt water. That actually works.
Don't want to be dealing with him this time around. What's the final ban for TL gonna be here? A little bit of time left to choose.
And voice changes. What else we got here? Can you even see that? Oh, I have a fucking idea. Hi-ho, hi-ho, it's off to work we go. With a tap, 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 and a wind, wind, wind. Hi-ho, 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 hi-ho. There we go. Eat smaller meals more frequently to decrease the risk of aspiration. That feels like a trick. Feels like a trick. Increase his intake of pickled vegetables to add. What the fuck is fiber gonna do? What the fuck is fiber gonna do for this guy? That seems like some shit you'd see on TikTok. Oh, do you have esophageal problems? Eat pickles!
3 games in a row now we've seen Sen and Nautilus locked in by blue side. 2 games in a row.
Swallowing difficulty.
So we'll see if that ends up being 3 here. It's a really powerful combo. It's kind of... It's a little shocking to me, actually, that...
Well, here's the
so
thing,
many
right?
teams unanimously will play it when it's up, yet 3 teams in a row will allow it to be up and let the other team play.
Right, it's kind of the priority doesn't feel completely aligned since it's not
Keep it
ban-worthy,
raps with
but it's
Ashley
first
for
ban.
me.
It's aligned enough that everyone's doing it, but not aligned enough that people are willing to ban it. It's just, it's surprising it happened 3 games ago.
Well, they're also going to take the chance on Energy side to lock in the Aatrox before we get
Keep
to the
it
second part of the
wraps.
bans. We'll see. Does Team Liquid want to go ahead and answer that right now,
I
or
don't
are
even
they
know.
confident that they can just wait and pick their top laner during the second half of the game?
covering Rel, which would show that it would be farming Seraphine if they lock it in. Although Rel could still be flexed to the jungle, so we don't know for sure. There's a lot of unknowns with the first 3 picks of TL's draft.
Where are we going here with the bans? The flex power on TL, very important, like you're talking about. Over on energy side, we pretty much know where the 3 champions are going, right? It's not like that's going to...
Oh my god, that's not the letter I'm typing. Oh, no, snap, no, autocorrect. Fucking autocorrect.
You need a long range mage mid. So, Azir is gone. I don't know. Oh, Waze banned. I was about to say that. So, who is it? Power Fox? I'm trying to think what he really plays. Talia's is gone. Oriana's gone.
That's a lot of champions down there.
Hi ho, hi ho.
Do you think TL just double bans?
It's off to work we go. Anyway, so conundrum. I feel like the larger meals and the smaller meals both risk for aspiration. You're gonna aspirate regardless. I feel like it's gonna be like the same amount. I'm gonna say small frequent. I'm going with small frequent. Why small frequent? Because with the large meals, you get bloody tired, man. You gotta think about it. Like, it's not a spry young man eating this food. Okay? It's a fucking middle-aged man with cancer and swallowing difficulties, okay? They can't just fucking throw down a hot dog, no bite, 1 bite challenge. They gotta cut that shit up, put it in their macaroni, like an Easy Mac microwave shit, and then eat that. Because their throat could get tired, their mouth could get tired. I'm gonna go small frequent. Small frequent is usually the answer. Now, it says which recommendations would you consider for to address this issue. Gargle with salt water to help the hoarseness is not the issue, and adding fiber to his diet is not the issue. So I'm going small frequent. That shit just sounds right. It just sounds like that would be the correct answer. Larger meals? I don't know, man. I don't think so. Dude's not bulking. He can't. Not Lee. Alright, let's talk about esophageal angiocarcinoma. Esophageal adenocarcinoma is a cancer affecting the esophagus cells that make mucus and fluid known as glandular cells. Esophageal adenocarcinoma is strongly associated with obesity and gastroesophageal reflux disease, while an even greater risk is the addition of tobacco use, work-related exposures, genetic predisposition, indigestion of large amounts of pickled food. Oh, which I guess is common in some Asian countries. Alcohol consumption and HPV infection can also predispose a patient to the development of esophageal cancer. The fucking pickled food thing. Exposure to silica dust and airborne metal have also been associated with GI cancers. Barrett's esophagus increases the risk of developing adenocarcinoma. Signs and symptoms. Often not initially distinctive, dysphagia and weight loss are common early symptoms. The person reports taking increasingly smaller bites of food or eating foods that are easier to swallow, inadvertently causing weight loss or malnutrition. That makes me think it would be larger. It says larger meals, less.
He can really allow your lanes to get ahead, and then late game comes, whatever. He's still a ball of stats.
It might be larger meals, less.
I know that Kobe's been a big fan of Volibear Jungle recently. Been really excited about the
let's
buffs.
find
Been
out.
playing it a lot in his own games.
So that one's
really excited about something.
So chest pain, hoarseness, coughing, feeling that something is caught in the throat or chest. Esophageal bleeding can be a potentially deadly symptom of esophageal cancer and is a medical emergency. Black tarry stools may indicate bleeding from high in the GI tract. No. Warrant, sound the alarm. Evidence-based practice alert. Pay attention. Write this shit down. Don't watch LCS. I can't stop watching LCS.
How do you feel about this being
Current research indicates that 4 genetically inherited syndromes may contribute to the developing esophageal cancer. Future studies will focus on using this discovery to aid in screening and treatment. In addition, targeted therapy. Wow, that was useless. That was a useless information box. Way to tell me absolutely nothing. It said, there's research happening. Wow, no shit.
He's really good early. That's fair.
Screening for esophageal cancer. I need to see non-alcoholic. I'm not gonna get esophageal cancer from drinking this.
At 4 minutes, but we actually have something more pressing with his ale on the stage.
Regular screening for low-risk patients without symptoms is not recommended, as there is no evidence that these screenings lower the mortality rate or decrease the risk. In addition, screening upper GI endoscopy or other invasive procedures may cause harm if tissue damage or reactions to the medications provided during the procedure occur. However, patients at significantly high risk, such as those with Barrett's esophagus, should have periodic examinations via upper GI endoscopy. Diagnostics is confirmed by undergoing an esophagogastroduodenoscopy. I bet you can't even spell that. Let me say it again. Esophagogastroduodenoscopy.
Don't go calling for the
Duodenoscopy.
We'll see what is going to happen. We'll see if it gets spicy on the rip. Thank you both. Good luck in the game.
With at least 4 biopsies of suspicious areas. In addition, MRI of the chest and thoracic region, PET scans and CAT scans are used to determine disease staging. Stage 2 and 3, sorry, that was just so incorrect. Stage 3 and 4 diagnoses involve tumors that invade the deepest layers of the esophagus and regional lymph nodes. Treatment usually involves a combination of surgery, chemotherapy, and radiation. And esophagectomy is the surgical removal of the affected area of the esophagus, as well as local or unaffected lymph nodes. Sorry, local or affected lymph nodes. This procedure can be indicated if significant amount of tissue is involved. Efforts are made to maintain the passageway for food by connecting the esophagus' upper part of the stomach's remaining part. If this is not possible, it may be necessary for the patient to have feeding gastronomy placed. Post-operatively, patients require gastotomy or jejunostomy tube. Intravenous therapy or supplemental oxygen. The feeding tube remains in place until normal diet can be resumed and the anastomosis between the esophagus and the stomach is healed.
I'm ready to go, baby.
There's some big fucking words,
So
dude.
close in the standings, right next to one another.
Large words. Large, strong, powerful words.
Yeah, well, I mean, that's what Palafox said, right?
Yeah, just double checking.
Yeah, he said we whooped you guys last time.
AP's always so confident. You never know.
All chat, APA just giving him the GLHF, the sportsmanlike conduct. All right, let's hop in here. Let's see how it's going to go. Ladies and gentlemen, it's game number 3 of the day. A reminder also, after today's games, we are going to be rating contracts on his personal stream, as he will be doing
The same scene, it's a goddamn mom's race.
About it. Head on over there once the LCS is done. But remember, we still got this one and then one more game after this before we get to that. Starting off here at level 1, everybody's just drawing the lines of scrimmage. It does not look like any shenanigans are afoot just yet. There's a lightning bolt. That's about it.
I was talking with Kobe earlier about Volibear, and he told me that he'd given contracts all of his tips. And I asked Kobe what the tips were, and he says, not for you. So
Not
like,
for you?
Yeah, they're like secret. He thinks it's secret tech. I don't know how much secret tech there can really be on Volibear, but I'm going to be on the watch for it.
Okay, yeah. Let's see if there's anything super spicy, some crazy hidden Volibear mechanic that the 3 of us are not aware of that Kobe has managed to discover. The Oakland versus Impact up here in the top side. Again, we kind of flashed those stats when the champion was locked in for Impact as not Udyr. It's been a big Udyr factor for Team Liquid so far this year. Impact's going to have to kind of shake off some of that bad mojo if they want to come out on top.
Absolutely.
Ain't nobody give a shit.
Do a lot of, like, he really just has to do a lot of things. Impact has to get really strong, otherwise the MR stacking's going to be
If it's not for you, it's good for
with the
you.
Senate healing coming in from the back line. So a lot of pressure on Impact.
It's going to go down here at the level 1. Just immediately trading with Jan and Cord. Nice dredge line there from Huhi.
Anywho,
How do you see this bot lane playing out?
complications from esophagectomy can affect multiple body systems, with an overall mortality rate of up to 22%.
Diving is very good. And
Recent studies indicate that despite the high complication rate, approximately 86% of patients have an improvement in their symptoms. Frequent complications may include the following: respiratory complications, such as atelectasis, pleural effusion, pulmonary embolism, acute respiratory distress syndrome, bronchospasm, and pneumonia. Cardiac complications, such as arrhythmias and heart attacks. Surgery-specific complications like wound infection, anastomic leak, stricture, conduit ischemia, laryngeal nerve injury, dysphagia, and gastric symptoms. HOG. Chemotherapy and immunotherapy may also be part of the treatment regimen. Current research indicates that chemotherapy in combination with radiation therapy improves outcomes, especially if used before surgery, although common chemotherapy-induced side effects are neutropenia, stomatitis, mucositis, diarrhea, and emesis. Common side effects of immunotherapy can include fatigue, cough, nausea, skin rasp, poropatia, constipation, muscle or joint pain, itching, fever, diarrhea. More serious complications of immunotherapy may include infusion or reaction to the autoimmune. Radiation therapy in conjunction with chemotherapy may be used when surgery is not an option. This may be due to the patient's refusal to undergo surgery or the inability to tolerate surgery due to poor overall health. Radiation may also be palliative in advanced esophageal cancer cases. Let's go energy. Let's go energy. Let's go energy. Let's go energy. Potential complications associated with radiation to the esophagus may include damage to the heart, lungs, or spinal cord, fatigue, skin issues such as radiation burns, compromised healing ability, and pain. Oh boy. Love pain. Esophagitis, which can lead to difficulty swallowing and result in nutritional deficits that require supplementation. Formation of esophageal structures or shrinkage of the tissue, which leads to difficulty swallowing and may require esophageal dilation.
Really bad in the first 9 games of that summer split when they ended up winning the split and then beating G2 at Worlds. So it's a little bit.
What they got? They got GI Tract, Contracts playing Bully Bear, Crazy, Palafox is on RA, they got Senna, Nautilus. Can't really see the other teams right now. Anyway. Skin issues such as radiation. The effects of surgery, radiation, and chemotherapy make patients susceptible to compromised nutritional status and swallowing complications. Esophageal fistula formation. Tissue breakdown from radiation may cause an opening between the esophagus and adjacent areas, allowing GI contents to leak from the opening and potentially leading to infection or serious injury. For example, a fistula to the lung may allow GI contents to move into the lung and may be fatal. Case Study 2, Part 2. Put your fucking listening caps on. Lee underwent radiation and chemotherapy for his esophageal cancer. However, he reports that he has been having increasing difficulty swallowing since his treatments began. The nurse suspects that he has developed esophageal strictures related to his radiation therapy. This will likely require multiple dilations. After the nurse confirmed this with Lee's provider, she explained the process and provided emotional support for him. Well, I have no idea what a stricture is. It is just assuming that I know this, which I do not. So, this might be tough. So, Lee was speaking with the nurse about was that say news? Nurse about the esophageal dilation.
to just start these grubbies because they moved up their
After
entire
she
bottom lane. Team Liquid not going to be contesting
explained
because I think they'd rather look for
the
plays on side.
process
So
to
a good rotation here by
him,
Energy, just unfortunate what
what
happened to Oklahoma.
statement
Energy will grab the first 3 grubs there, so
about
that means they'll be able to spawn the
esophageal
baby grubbies as long as they get at least 2 of the
dilation
next set.
indicates
5-minute delay, I believe. on the
he
first one.
needs
Looking
more
for the 12-minute
education?
mark, but remember, they are automatically replaced by the Herald at 14 minutes, so it'll be a pretty tight window to take that second set.
More
Checking in on the mid lane
education.
matchup. I'm curious if APA is going to be
Motherfucking
going with
A,
build.
probably
Most
something
likely not
stupid.
because he's gone fleet already.
The healthcare
And relatively low damage
the
team, but it is something
healthcare
that Tract would show up in the
provider
last game.
may.
Reason to throw card.
Whoa, is he
Pixel
performing
Mask
it?
Trying to get this bounty off of Impact, possibly. That's a very healthy Asante.
Yeah, but
I don't
Contracts is
think
level
that's
6. The
correct.
volley bear can just flip the switch, turn these turrets off whenever he needs to. Impact already down to half HP, but he's fighting them off.
Okay.
Energy's still looking for the angle here. Impact's just doing a great job. They're gonna try to clear up the next wave. I'm
Endoscopy.
not quite sure. They're at least looking for a TP, I suppose. The teleport used by Team Liquid, ready to reinforce up here.
During the
That's it. We're not gonna get a dive
procedure,
after all. It was just a test.
he might experience mild pressure
What was the plan there?
in the back of his throat or chest.
Yes, that's what I
Oh,
was
my
expecting.
forearm! Why is it bothering me? I'm getting esophageal strictures in my forearm right now.
2 seconds. So it's pretty brief. Yeah. And the setup
I'm
has
getting
swiftness
carpal tunnel
boots and a blade.
from
Doesn't really
typing
do damage.
weird.
Aatrox is also
The dilator will cut off his airway during the procedure.
I don't
Yikes.
know if that dive works even if they pull the command.
Yeah, I mean, it kind of goes 2-0. Tabbies.
I don't think that's right.
rollers,
Oh, I do. Procedure. Procedure.
Look at it. It
The
is
procedure.
2-second duration on the tower disable plus 1 second per
He
life.
might experience a mild sore throat for the remainder of the day after the procedure. I fucking bet he will, actually. So, not that.
If you couldn't kill Impact when he was alone, you're definitely not going to kill him with Rel right beside him. Or JJ just guaranteeing that there's no chance for them to try to make a dive happen here. The wave will crash into the turret. FBI and Dokla trying to see if they can just get a little bit more poke in this thing. They do have the
The
extra
day after the proceed. So, which one is untrue, pretty much?
For me,
not bad.
What statement says that
Waits on the tower, whereas
he'll need more education?
good swap. I mean, I still
Well, one,
went pretty bad for Energy.
I don't
but
think the
comp
healthcare
still
provider's
seems
gonna do it,
so
personally.
good. I'm just not seeing currently. I'm really just not seeing comp come
But,
20,
I
30
don't
minutes.
know,
being
maybe they
effective.
will, maybe it's within their scope.
2 kills, which should
The
be
procedure, he might
worth
experience mild
it.
pressure, that's probably true. He might experience a sore throat, that's probably true. It'll cut off his airway. It fucking...
Yeah, Dokla's died 2 times. You'd rather
No.
have that not be the case, but hey, it could be a lot worse than it is. As for JJ,
It's sedation and upper endoscopy.
to maintain his presence here in the lane. As you can see, Contract is
I have a
providing
slight
the
feeling
away the red buff from Umpty.
it's not gonna
Impact
cut off
steps
his
forward.
airway.
JJ coming in for the shattering strike. His FBI is gonna be pulled back, but he all-
Because we're not giving people traits for
And Impact goes on a killing spree.
esophageal for upper
Teleport's gonna make its way
GI
behind now.
motherfucking
And he wants to reinforce. Contracts is going
endoscopy. So I'm gonna say it's C, but we'll fucking see how this goes.
And now you got Dokla.
Space shift. I'm gonna shit my pants, dude. So I'm gonna have to DRB here. Watch some fucking LCS skin. Whoops, that's not what I wanted. Watch some LCS. Let me shrink. Just go watch it. I gotta fucking shit.
Okay, we're not done yet. Never mind. Hold on. Here comes the shuffle now. Umpty's in trouble. Palafox gonna pick up the first kill of the game for Energy. The extended fight sees Energy finally making their way onto the board, and now Dope was about to get even more money from the turret plate.
And this whole time that Jan was solo in the bot lane, he got 1 plate? 1 plate? That fight was 3 minutes long, it felt like. It was probably more like 60, 75 seconds. But that looked like it was a disaster with almost everything going right for Team Liquid. Impact is doing everything he can, but the gold is still at about 100.
Yeah, I've been overstepped here just a little bit for the Asante Q.
Oof. But even though FBI drops here, the extended fight going as long as it does, it still ends up being a 2-for-1 trade, and plates end up going over to Energy, so it doesn't even feel like there's really much of an advantage for Team Liquid at all. Yeah, absolutely. The kill going over on Impact, don't know if he's going to be able to carry the game with tank build. You can see down in the bottom corner of the screen as well that Team Liquid is picking up their first Drake, but has been traded, I think, for a lot of turret plates up top. It's been traded for a lot of turret plates, and also critically the other 3 grubs. Energy got them as they spawned, so Energy is now in a 6 grub game state. Feeling really good about that. One other thing to track during this game, as we might have to put pause on this before JJ moving up with Impact. Okay, Dokla, knocked back by the Q3, the Intofo strikes. Trying to keep him around here. Shattering Strike stuns him up, but there's nothing left to follow it up with, so Dokla's just fine for now. Yeah, if Energy ends up taking over this game late with more kills, did you know Huhi is 9 assists behind Impact for second LCS all time, but this fight is not ending. Umpty with the double knock up there on the Snapcast ulti. Dokla trying to return some pressure here with the World Ender as Impact steps in front of his jungler to keep him protected with a Pathmaker. Now Team Liquid disengaging this one, even though they've got a 3v2 fight. You don't know where everybody on the enemy team is, so Team Liquid's gonna back that one up as APA uses his teleport to return the lane with the Azir. You can see the items in inventory. Does not look like we will be getting the tank Azir, at least here at the start. Rico tells me that's not the case. Impact again, gonna look for an opportunity as Dokla's forced to flash away, and he steps just to the side of that third Intofo strike. Man, Team Liquid is just out of sorts. They're forcing so much. The gold lead just keeps getting farther and farther behind. They invested 3 people top lane, but they're losing plates bot. They're losing their jungle. And after what I was going to tell you is Huhi's 9 assists behind Impact for second place LCS all time, but Impact is 1,150 assists behind you. So you have a monumental assist lead on the LCS. Just wanted to get that out there as they go for Dokla.
I don't gotta come back anytime soon.
Yeah, man, you are way out in front, and it looks like Dokla is way down deep in the ground. Another kill going up there in the top side. Impact 3-0-2 here on Cassante. Dokla drops to 0-3-1 on the Aatrox.
Honestly, it's probably I've never seen so much fighting top lane where the supports are laning top for 5 minutes. It's crazy.
That island has become a vacation destination for both teams here, but it is Energy. Despite the fact that the kills are 1-5, Energy's up almost 1,500 gold. The Drakes are tied 1-1. We have the next one not spawning for another 2.5 minutes. You can see the Herald is live on the map, but Core JJ now has to crash down the opposite direction as he does not want to get caught out by Palafox and the rest of Energy. TP coming back in from Impact, I'm assuming. Yep, there it is, as Dokla continues clearing out the control boards here. 11 plates for Energy. That's a lot of plates. If I saw that right, that's the reason they're heading gold here, because you look 1 kills to 5, but they've just been consistently applying lane pressure. And yes, Umpty's been able to get 2 kills, and Impact had that solo kill up top, but I don't necessarily think where it matters. Like, if Team Liquid wants to win, they need kills on Azir and Seraphine. Well, Huhi's already gone in, and Yon's under pressure. FBI's ready to follow it up and try to take him out. Core JJ with a Magnet Storm, but where's the damage? Team Liquid deal no damage. They're gonna kill Palafox, but that's the only one. Contracts taking a kill there on APA as Impact versus Dokla is a fight that won't really go Big Doke's way. Energy coming out on top right now. They put a lot of Team Liquid bodies in the dirt, and the Rift Herald's gonna be their prize.
Now that I look at it, Poppy probably not the best pick.
Definitely not with Nice Foul.
You definitely wanted some AD damage somewhere in your comp when you have Seraphine here.
I mean, that is what we've been saying, and it looks like it's true. Yeah. Even with the, like, if you're going to win a fight, it would actually be that 14-minute fight before people have really had time to itemize, and you're kind of just dealing with the base damage of the kits, but they did no damage. The Hollow Radiance are ready for Nautilus, exactly what we expect. Contract's next item is going to be big MR. I mean, Energy hasn't even really started itemizing the items that are going to completely shut down the damage, and they're already winning fights.
Yeah, we had a great hook here on Seraphine. Just instantly fights over once this lands.
Yeah, I think a lot of Team Liquid's team fighting is supposed to be about being able to play behind Seraphine and maybe just winning some long fights, but he absolutely couldn't be a part of this fight once he got hooked. He's just kind of hiding in the pit. He gets 1 Q over the wall onto the front line, not really able to heal anyone else, and then Dokla just finishes him off. So great engage by Energy, but I think the comp differences are pretty real. You can see that. Ah, that was cute. Smiling Palafox. Man, And back to what I said at the end of the draft, the head-to-head between Palafox and APA, you can even see here, APA's words. It was a good tweet. I think he's probably the player that had my number the most, so I can't really say anything. And this is after Palafox told him, call me daddy. So APA has not had the best record going up against this guy. And once again, gentlemen, it's looking like an energy-favored game. Nearly 2,000 gold ahead at 17 minutes.
This one in particular doesn't feel like a Palafox versus APA, but it definitely feels like an energy versus TL. So the streaks may continue here. Next Drake being set up. Afro, what do you think Team Liquid has to do here? Being down 2,000 gold, they're definitely going for it.
Yeah, they're going for this fight, but I would just wait for 2 items. Most likely, people start doing damage to people. He's basically invincible right now. He's taking 3.
He is. Look at his health bar.
Support Nautilus, the ultimate Chad. He's just leading the way in the middle of 5. The Dawning Shadow over the top as Impact goes all out, looking to finish off Huhi. But he's so damn tanky. Umpty's going to be dropped at the exact same time as a 1-for-1 here so far. But Energy's looking to make it even more. APA gets caught over the wall, and Palafox is ready to keep on chasing him. He fires the charm out, but it goes wide right. Now Contracts is waiting for the flash follow, and APA is going to drop. Contracts needs to get away from the turret, but the last shot should finish him off. It'll be a 2-for-2 trade at the end of the scrap.
That's about as well as Team Liquid could hope that fight goes. They actually do kill Ruhi, the Giga Tank Nautilus.
As soon as they invent smell-o-vision, that shit, you're coming in the bathroom with me. Alright, make that bigger. I'm not getting copywritten or shut down or any of that shit. Not today. Anyway. Patients undergoing radiation therapy should ask their provider about appropriate lotions and or salves for radiation irritation or burns. These areas are highly susceptible to infection and additional irritation from additives. Numerous salves, lotions, and dressings are available. However, there is no superior treatment from these categories. Imagine that. It depends on how your body reacts to it. A fucking thought that people don't have. The post-operative and radiation post-operative and radiation patients begin to tolerate advances in diet, it is critical to observe for aspiration or sudden changes in pain level. Each step in changing the diet should be started with small amounts at intervals as tolerated and always lead to the head of the bed elevated. You can't eat lying down. This is gonna hurt yourself. Patients and families often need significant emotional support as well as assistance with the patient's physical needs. The prognosis for esophageal cancer is generally not good, and as the disease progresses, information about home health. Oh yeah, okay. Call the fucking health center for palliative shit. Maybe that's what you get for smoking for 50 years. You know, maybe this is. Ever consider that's exactly what you get for living life on the edge? Case study number 3. Mrs. Dasher is a 75-year-old retired biology teacher. She has taken verapamil and a low-dose aspirin daily since a mild heart attack 5 years ago. She is also being treated for asthma, which has been worsening ever since she contracted COVID-19. During a routine doctor's visit, Mrs. Dasher mentions that she has been suffering from severe heartburn for the past several months, especially after my 4th or 5th cup of coffee. Miss Dasher needs to be evaluated for GERD. Well, Miss Dasher, I don't know how to put this lightly. Fucking 5 cups of coffee? I think anybody with a little bit of sense in their head would be like, that's too much. P dash. If I could read, I might have something to say about that. Anyway, often referred to as heartburn, GERD is the backflow of gastric or duodenal contents into the esophagus past the lower esophageal sphincter. GERD is often dismissed as a minor annoyance. However, ongoing reflux may cause inflammation of the esophageal mucosa and result in esophageal ulcers, strictures, or Barrett's esophagus. All reports of heartburn must be carefully evaluated. Unfortunately, Team Liquid is winning. Oh, hold on. They're down in gold, but up in kills, and down in towers, and down in objectives. Never mind then, I guess Energy is winning. And down in Dragon. Evidence-based alert. Patients with asthma experience an increased incidence of GERD. Research also shows that GERD exacerbates existing asthma. Nerves in the lower part of the esophagus connect to the nerves in the lungs, causing acid reflux to trigger asthma symptoms. People with both asthma and GERD may find that treating GERD can help reduce their asthma symptoms and the use of asthma medications. Wow, that's actually kind of neat. Oh, we got a question coming up. Pay attention, boys and girls. Data have shown that 25 to 40% of individuals in the U.S. report symptoms of GERD at some time, and 7%/10% report that they experience symptoms daily. The actual percentages may be even higher because many people self-medicate over-the-counter preparations and never report their symptoms. GERD tends to be chronic, with relapse common, and long-term medication maintenance therapy may be required. GERD is often considered an adult problem with increased risk over 40. However, studies show that GERD is common in infants and children. Repeated vomiting, coughing, irritability, or colic, and respiratory problems may indicate GERD in this young population. Most infants will have a resolution of their GERD by age 6 without any treatment, as the infant is typically able to sit and eat some solid food by this time, and the lower esophageal sphincter has matured. By the age of 10 months, 90% of cases are resolved. Under normal conditions, the lower esophageal sphincter contains enough pressure around the lower end of the esophagus to close it, thus preventing reflux of gastric or duodenal contents. The sphincter relaxes after every time you swallow, allowing food to pass into the stomach. In GERD, the sphincter does not remain closed because inadequate lower esophageal sphincter, LES, I'm just going to say, pressure, or the pressure in the stomach, propels gastric contents into the esophagus from the hiatal hernia or obesity. Stomach contents are very acidic and cause pain and irritation when they move into the esophagus. The esophageal mucosa becomes inflamed, which can decrease LES pressure and more until there is a recurrent cycle of reflux and heartburn. Now, I feel like some people don't realize that your stomach acid is acid. Like, it's 2 on the scale. Your stomach acid is rated like a 2. So, let's fucking go. Question, no, did I do 1? Alright, well, we're on question number 4.
This is where the comp either works or it doesn't, and it is kind of close to working, even though I was a pretty big initial skeptic.
Question 4. All of the following are risk factors for the development of GERD, except what? Motherfucking aspirin use, excessive coffee consumption, motherfucking asthma. Well, we just learned as all of these things. Stupid ass dum-dum. History of heart. Alright, so here's the thing. This bitch, what's her name? Miss Dasher, Mrs. Dasher. This bitch takes that. It's the heart attack isn't the problem. It's the aspirin she's been taking from the heart attack. That is the problem. You can have a heart attack in the past and not get GERD. So, that's just obviously the correct answer. No challenge there. Let me just circle that shit real quick. Circle that shit real quick. You don't have to take aspirin if you've had a heart attack. Are they going to recommend it? Yeah. Yeah, they might. But do you have to do it? You don't have to do anything you don't want to do. Believe it or not, fun fact, you can not do things that your doctor suggests. And you can say no to treatment. You can. You know what? We don't give a fuck. You're like, no? Okay.
Oh, and then he gets bashed away.
Educate you a little bit. Here's what's going to happen if you don't. Here's what could happen if you don't.
It's almost like he,
I don't give a shit
yeah, you almost need
if you don't do
Power Fox, as you say,
what's
to get one.
recommended. And we got a nice little picture that you can't see here. It's of a healthy stomach and a GERD stomach, and how with the GERD, the acid is infiltrating the esophagus. So just imagine that. Anyway, risk factors associated with the development of GERD: hiatal hernia, which is a hernia in the top of your tum-tum, where the top of your tum-tum busts through your diaphragm, which is the muscle that helps you breathe. So it busts through that, and then it kind of gives you a little pocket. So there's like your hernia, and then the rest of your stomach. And then acid can get stuck in there and like go up into your little throat and give you a little bothersome. It can be a little bothersome. Conditions that cause delayed gastric emptying. Conditions that cause LES dysfunction. Conditions that increase abdominal pressure. Pregnancy. Obesity. Medications including anticholinergics, benzodiazepines, NSAIDs, aspirin, nitroglycerin, albuterol, calcium channel blockers, antidepressants, and glucagon. Acidic foods and drinks. Coffee, alcohol, soda, buttery drinks. Shit, I drink a lot of energy drinks. I might. There are a lot of things that could happen to me because of my energy drink consumption. The most common presenting symptom of GERD is burning pain in the epigastric area, which patients may report as experiencing heartburn. It is not heartburn. Heartburn has nothing to do with your heart. Often, GERD presents in the same way as a myocardial infection until cardiac etiologies are ruled out. The symptoms often should be treated as such. Pain often occurs after a meal or when lying down, and patients may complain of fluid accumulation in the throat or having food stuck behind the breastbone. A chronic cough or hoarseness upon awakening may develop as a result of reflux of gastric contents. Diagnostic tests for GERD. Diagnostic tests for GERD focus on identifying the underlying cause in addition to a careful history of and physical. Several specific tests are conducted. Ambulatory 24-hour pH monitoring. Wow. Assesses the competence of the LES and measures the reflux activity over 24 hours. This helps to determine if reflux is the cause of this problem. Oh, my background changed. Distinguishes reflux from cardiac problems and links episodes with symptoms. Esophagogastroduodenoscopy, EGD, used to evaluate the extent of the disease and identify pathological changes. Barium, swallow, esophagram. You ever get sad? I get sad sometimes. No, it's not right though. What it's often. Barium swallow esophagram, used to identify if a hiatal hernia is a causative factor or if esophageal stricture is a complication of GERD. Esophageal manometry measures the strength and function of the esophagus and the musculature of the throat and esophagus. I've said esophagus so much, I never want to say it again. Esophageal muscle pressure, movement, coordination, and strength are assessed. Esophageal sphincters are evaluated with particular focus on the LES in patients with GERD. Esophageal impedance pH study measures how liquid moves between the stomach and the esophagus. This can be a helpful test to distinguish acid from bile reflux in patients who have had normal Bravo result. Bravo. BRAVO. Barium. Nah, I don't know. Treatment goals and shit. Oh, let me get this. Let me put this down. We're done with the question. Let's watch LCS. Oh. NRG is ahead with, tied with Dragons and losing. down in kills, but up in gold.
When you're a 1 damage comp and the 1 damage guy gets Nautilus hooked, there are problems on the horizon. 11 to 9
Anyway.
kills, still favoring Team Liquid, but it's a 7,000 gold lead nearly.
Treatment goals are good are to control the symptoms, promote healing of the esophagus, and prevent or manage complications. Symptom control focuses primarily on lifestyle modifications such as the following: dietary habits, don't eat foods that trigger it, positioning, do not lie down, weight, lose weight. Lifestyle modifications can promote the healing of the esophagus and control symptoms. Many patients also take medications for the treatment of GERD. Antacids neutralize acidic Nursing alert. Wow. Studies have shown that H2 receptor antagonists are effective for healing mild esophagitis, but are less effective when the esophagus is eroded. More severe cases or cases with esophageal erosion may require using a PPI. A review of prescription or over-the-counter medications to identify possible drug interactions is important for patients who frequently use antacids. Evidence-based practice, protein pump inhibitors limit gastric acid secretions and facilitate rapid resolution of symptoms and esophageal healing. Examples of approved PPIs include Bralosic, Nexium, Protonix. PPIs should be used only with a confirmed diagnosis of GERD. Interesting. I should pay attention to that next time I have to give someone a PPI. Chronic use has recently been shown to be associated with the following conditions. Calcium homeostasis can be affected, increasing the risk for bone fracture, especially hip fractures in older adult women. We go, men. No hip fractures for us. Colostrum difficile infection, aka C. diff, aka the stinkiest poopies you'll ever take in your entire life. Iron, magnesium, and B12 malabsorption. Kidney disease. If treatment is unsuccessful, surgical options for the treatment of GERD also exist. However, evidence is conflicting about whether surgery is an effective long-term solution. In a recent study reviewing the effectiveness of the surgical intervention, surgical intervention fundoplication, 7.6 of the studies required revision of the original surgery, and 53.8 required anti-reflux medication within 6 months of their surgery. So, does it even work? Does it even work? Does it even work? Does it even work? Best I ever had. Best I ever had. Best I ever had. Yeah, you the best. You the best. Oh, finally, they're tied in kills. End it, NRG. Let's go. How you gonna be 10k up and you're not over? It's not over. Anyway. Moving on to Barrett's esophagus. In addition to helping patients adhere to their treatment regimen, nurses must be alert and teach their patients to be alert to the possibility of developing Barrett's esophagus. Barrett's esophagus is a disorder characterized by normal tissue that lines the esophagus being replaced with tissue similar to the lining of the intestine. That's not right. Barrett's esophagus does not produce signs or symptoms. Its cause is unknown, but often found in persons with GERD. The disorder affects up to 20% of adults aged 50 and older in the U.S. It affects men about 3 times as often as women. That's an L. And white men more often than men of other ethnic backgrounds, so it's racist. Smoking also increases the risk of its development. Smoking causes everything. Smoking and obesity are actually just like symptoms of fucking everything. Every health condition you could possibly have, that you can get it from smoking, you can get it from being overweight. Well, not overweight, but obese. According to one recent study by Kiehu and Mohiriji, about 15% of those with GERD will develop Barrett's esophagus. because there are no specific signs and symptoms. Physicians may recommend that a patient over 50 with a lengthy history of GERD be screened for Barrett's esophagus. A small percentage of patients with Barrett's esophagus may develop esophageal adenocarcinoma because of the lack of symptoms. This cancer is often not detected until it is advanced. Barrett's esophagus is diagnosed via upper endoscopy and the biopsy. After insertion of the EG tube, the healthcare provider can inspect the lining of the esophagus and note the presence of an abnormal lining. However, biopsy of the lining of the esophagus is necessary to confirm the presence of a malignancy. Fucking sick of reading. This chapter is long too. It says like contact hours to renew my license. I need 15 contact hours. This chapter, it's gonna give me 7. The other ones give me like 2 each. This is 7. This is a fucking long one. And it started at the mouth. I bet it's gonna end at the fucking rectum, dude. You ready for chapter? Anus. Anyway. Several treatment options for Barrett's esophagus with severe dysplasia or malignancy are available. The focus of these is to destroy or remove the section of the lining that... How are you 10k up? End the game. NRG. You got the Soul. You got the Baron. You're 11k up. Go. Just go bot. Just bring all your fucking friends down there. You got minions. Literally, if you just have Dokla start hitting the fucking tower, they're gonna go hit Dokla, and then you can just go hit the bot tower with the 3 of your guys that are there. I'm not a professional League player. Anyway, radiofrequency ablation. This treatment uses radio waves to kill precancerous and cancerous cells by heating an electrode with an endoscopy. Endoscopic cryotherapy. This approach uses liquid nitrogen or other cryogen to freeze the area of concern, disrupting the ability of the mutated cells to reproduce by damaging them and the vessels that supply them blood. Endoscopic mucosal resection. During an EMR, the affected mucosal lining is incised and removed through an endoscope. Complications can include bleeding or tearing of the esophagus. EMR may be performed in conjunction with PDT. What the fuck is PDT? Esophagectomy may be recommended in severe dysplasia or malignancy cases. We still haven't ended the game. 11k up, and we're still not ending the game.
This happened after all 3 of their inhibitors were down, and they'd already lost an extra.
NRG.
One more time as they're able to kill. I saw the pick on Palafox. I need to see how they end up getting on FBI. So evidence-based
practice alert. These things are used. Oh, H. pylori. Previously, it was thought that the back. Okay. Esophagitis. Esophagitis is the term used to describe an inflammation of the esophagus lining, which can cause pain, bleeding, and dysphagia. Esophagitis can be caused by a variety of factors. Certain medications, including NSAIDs, aspirin, osteoporosis medications, and iron supplements. Cancer treatments such as chemotherapy and radiation. What else? Well, let me tell you. Certain infections, including candidiasis, herpes simplex virus, and cytomegalovirus. Certain allergies or inflammatory reactions, such as asthma. Diagnosis typically involves an esophageal barium study or esophagography, especially in patients with dysphagia. An upper endoscopy can also assess the extent of tissue damage and identify erosion areas. Most cases of esophagitis resolve within a few days of identification once treatment is started, but it depends on the underlying cause and whether that can be corrected.
Well, but also remember, his armor and magic resist are both at about 2/3 reduction, so you have to triple his HP for his EHP, so it's about 20,000 EHP. on Nautilus
I'm
right
surprised
now.
that this game isn't over yet.
He's getting juggled around, but he just does not get
It's kind of ridiculous.
20,000
They had like 2 chances.
We got Thanos in the game.
And they're like, nah. Nah.
You just can't kill the guy.
How about we fucking diddle around and waste Baron instead of ending the game? You know, it takes Korean teams 1 Baron to end the game. Nah, not LCS. We need 3. I don't know how many Barons they've had,
because it's just Azir, Seraphine, and like 3 tanks.
but at least
It
1.
just becomes so comical.
Ooh, pictures in the next one. Treatment includes removing the identified cause, controlling GERD, treating infections, and relieving pain. If non-invasive approaches are unsuccessful, surgery can be performed. Nursing alert, womp 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 womp. Esophagitis can cause patients to have dysphagia, difficulty breathing, and an increased risk of choking, and airway blockages due to the formation of strictures. I still have no fucking clue what a stricture is, but they sound bad. Dysphagia can be so severe that some or all of the patient's regular medications may need to be stopped or administered by routes other than oral. Nurses should be aware that other conditions may temporarily worsen if this occurs. Patients' airways should be assessed regularly. Alright, now we're on to esophageal varices, which involves a lot of blood. Alright, FBI triple kill. End your fucking game, dude. Can you end the game? Kill APA. Thank you. FBI quadra kill. Ace? Alright, it's about time. This condition, which leads to dilated veins within the esophagus, is caused by portal hypertension, most often due to liver cirrhosis. About 30% of those diagnosed with cirrhosis have existing varices already, but at 10 years post-diagnosis, that climbs to 90%. Esophageal varices can be deadly. When one of these dilated veins ruptures, it can cause rapid and heavy bleeding, leading to hypovolemic shock and death. The risk of developing varices and subsequent rupture increases with severity of the liver disease. And we got a nice little picture that you can't see, because I'm not going to show you. Endoscopy is used to diagnose the varices. If varices are identified, variceal band ligation is often performed. This procedure involves placing elastic bands at the ends of the identified varices, effectively cutting off blood flow to the weakened area and preventing bleeding. Additionally, management includes treatment of the underlying liver disease or condition, treatment and prevention of secondary infection, hemodynamic resuscitation if bleeding has already occurred, and medications and procedures to lower portal vein pressure. That was a long sentence. Nursing alert. Patients with variceal bleeding are at increased risk for infection, with an incidence of 66%. Common infections include peritonitis, urinary tract infections, and pneumonia. Hiatal hernia. I'm fucking afraid of getting hernias. Even just the regular abdominal ones. I am afraid of those. Alright, I need to take a little social media break before I go on to the next chapter. Just need to see something real quick. Just need to see a little something real quick. Ooh, bang, 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 bang. Ooh, you know that? Oh, you just want to fucking, you know? That's how I feel.
Dude, why'd you put your new rig in the basement?
Alright, this is taking too long.
Basically, my new connection is so strong I can game anywhere.
Luigi's
Check it out.
domain
We got
expansion.
Gamer Rocker,
Oh, it's
Gamer
Luigi's
Floaty,
Mansion.
Gamer Couch.
Oh, Jujutsu Kaisen. You know that feel? Oh, you just wanna.
And Gamer Mower.
I'm getting there.
What's that?
Well, I'm there.
hard to get
I just
a
don't
lot
own
of
a gun.
That's smart.
But one day. Alright, let's talk about hiatal hernias real quick. That's the one with your tum-tum, when your tum-tum's bum-bum is a hum-hum. Hiatal hernia refers to the condition when an internal body part moves or pushes into an area where it does not belong. Usually, though, the muscle or connective tissue that typically keeps it contained. Hiatal hernia is also called hiatus hernia, is a deficiency or defect in the diaphragm that allows part of the stomach to pass through the opening into the chest. Hiatal hernia is generally caused by muscle weakness during the aging process, with 70% of cases occurring in those over 70. Kill me at 69. They are more common in people who are overweight. Fucking told you. Always. Don't smoke, don't be fat. Then you'll have like less problems. It's a very left-sided win. Because we got Shopify, Cloud9, NRG. We just need 100 Thieves to win, and it's just purely a left side win. Not necessarily blue side. Was Cloud9 blue side? I feel like FlyQuest was blue side. I don't remember. I don't care. Most hiatal hernias are usually asymptomatic. A hiatal hernia is generally found when GERD worsens due to movement or trapping of the stomach acid in the areas of the stomach that has herniated. Because the stomach is displaced or stretched, there may be feelings of fullness in the chest or chest pain similar to angina. Other symptoms can include heartburn, chest pain, dysphagia, bloating, sour or bitter taste in the back of your mouth, or bleeding. Diagnosis of hiatal hernia is confirmed via various diagnostic tests and is often found during a workup of GERD. Barium swallow upper GI series may show a hernia has an outpouching at the lower portion of the esophagus. However, small hernias may be difficult to detect. Endoscopic studies allow the examiner to identify hiatal hernias and other gastroesophageal problems. No fucking shit. Nursing consideration. Patients with a hiatal hernia repair are at increased risk for reoccurrence, with a recurrence rate of 15 to 60%. Reducing risk factors including weight loss and smoking cessation can drastically reduce the risk of reoccurrence. There are two types of hiatal hernias, the sliding hiatal hernia and the paraesophageal hernia. Which one would you rather have?
There we go. Appreciate it. Thanks for the energy.
Okay, I'm getting sick of that position. A sliding hiatal hernia occurs when only the gastroesophageal junction slips up into the chest through the diaphragm. Asymptomatic hiatal hernias may not require any treatment. However, sliding hernias may produce gastric reflux symptoms similar to those of GERD. A sliding hiatal hernia may resolve between meals or flare-ups. In this case, treatment focuses on relieving and controlling symptoms through medications, avoiding constrictive clothing, eating small frequent meals instead of large meals, and avoiding alcohol, spicy foods, tomato juices, citrus juices, and nicotine products. Paraesophageal hernia. A paraesophageal hernia occurs when a portion of the stomach itself moves through a defect in the diaphragm and creates a hernia sac. A potentially severe complication of a paraesophageal hernia is severe pain and shock caused by incarceration. Going to jail. Incarceration occurs when a portion of the stomach is caught above the diaphragm, leading to gastric perforation, strangulation, bleeding, and even gangrene. Emergency surgery is moving on. Gangrene? Two of the worst things I've ever smelled in my entire life. Like third-degree burns on some woman's legs. Bad burns. So the smell of burnt human flesh. Gangrene. Fucking gangrenous feet. Ooh. Ooh, they're tied for like the top spot of the worst things I've ever fucking smelled.
It's not obviously being played, but nice note to the new patch.
Nursing consideration. When incarceration of the herniated tissue has occurred, it can present abruptly with a sudden onset of vomiting and severe pain. Surgical treatment. Surgical intervention for a hiatal hernia is necessary if the hernia has the potential to become constricted or strangulated. In this case, the hiatal hernia must be reduced or put back in its proper place. The type of surgery depends on the provider's comfort level and patient presentation. It can include laparoscopic surgery, excision of the herniated sac, repair with mesh, surgery to strengthen the LES by manually wrapping the stomach around the lower portion of the esophagus to create a tighter sphincter. We would all love a tighter sphincter. Laparoscopic surgery, called fundoplication, involves making several small abdominal incisions. Laparoscope and other surgical instruments are then inserted through the incisions. Surgeons can repair the hernia by viewing the internal organs through the laparoscope. Patients can usually ambulate on the day of surgery with assistance, be discharged on post-op day 1, and resume regular activities within a week. Soft foods can be Soft foods can be slowly into their diet. Soft foods can be slowly into their diet, and patients can usually resume a regular diet within 4 to 6 weeks post-operatively. Heavy lifting should be avoided for several weeks. Recent studies have shown that laparoscopic approach to hernia repair can lead to shorter hospital stays and a lower rate of complication. Whoa. 100 Thieves. You know, I want Dignitas to win, but 100 Thieves needs to make it a left-sided win day. Where the fuck are you going, bro? It's champ select. Sit down.
XU's had really good early jungling sense, so that's been a positive. One negative I'm going to give the draft, because Kalia Nautilus versus Tomcat.
Anyway, gastritis. Moving on. If there's 2 things any of you get out of this, it's stop smoking and lose weight.
Yeah, this is awesome.
Please.
Yeah, maybe don't take Nautilus away, huh?
It's possible. It was wishful thinking, I think. Yeah.
Gastritis is a common condition characterized by inflammation of the lining of the stomach and may be acute or chronic. In most people, gastritis is not serious and resolves quickly. However, some people may develop gastric ulcers, which increases the risk of stomach cancer. Acute gastritis has an abrupt onset but is self-limiting with chronic gastritis, while chronic gastritis can last indefinitely. If not treated...
Yeah, what's important here, of course, if you're comparing top laners, Impact,
I fucked that sentence up pretty bad.
They've all had a wealth of experience, so even if this is your
Sniper Rich Fudge
this is him
Impact.
as a rookie, like incredibly young.
When the stomach's protective layer is weakened or injured, gastric digestive juices penetrate the stomach and damage and inflame the gastric lining. Several factors can damage the stomach's protective layer and predispose a person to gastritis. Bacterial infection, drug use, alcohol use, older age, bile reflux disease, autoimmune gastritis, and various other diseases, such as, this isn't a disease, major surgery, trauma, burns, or severe infections, autoimmune disorders, food allergies, peptic ulcer disease, or parasitic infection. Fucking bunch of stuff, dude. Signs and symptoms of acute gastritis are abrupt in onset and can include indigestion, abdominal cramps, nausea, vomiting, bleeding can be present in the stomach, hemoptysis, hematemesis, I thought it was hemoptysis, which is bloody vomit, or melena, black, sticky stools.
And even though we've seen
Next page.
all of their band, just want to put it out there that this could just easily be a Kalia jungle. So
Chronic gastritis may produce signs and symptoms similar to those of acute gastritis, or it may cause only mild discomfort, such as slight pain or an inability to tolerate fatty or spicy foods. More severe or long-term effects can occur, including pernicious anemia, iron deficiency anemia, benign growth in the stomach lining, and, rarely, cancer. It is important to note that patients with chronic gastritis may have no signs or symptoms. Several diagnostic tests are used to confirm the diagnosis of gastritis. Upper gastrointestinal endoscopy, upper abdominal x-ray with a barium swallow, or blood, stool, or breath tests for H. pylori, which is a bacteria. Treatment of gastritis focuses on eliminating the causes of gastritis. Antibiotics are administered to treat bacterial gastritis. Histamine 2 receptor antagonists or proton pump inhibitors may be provided to block gastritis. Over-the-counter antacids may be administered to buffer the effects of the acidity of gastric secretions. Here's a nursing consideration. With severe blood loss, blood replacement may be necessary. Maintaining hemodynamic stability should remain top priority for nurses treating patients with acute bleeding. Frequent assessments for changes in blood pressure, tachycardia, changes in the level of consciousness, and diminished capillary refill should be conducted. Nurses should also observe for transfusion reactions. Lifestyle changes.
What's your thoughts on the draft so far?
You ready?
Yeah,
I bet it's going to say lose weight and stop smoking. Lifestyle changes may also help reduce the signs and symptoms of gastritis and include the following. Diet. Patients should avoid foods that trigger or exacerbate signs and symptoms such as fatty or spicy foods. Research has shown that diet and nutrition do not play as much of a role in the prevention or cause or alcohol intake. Patients should limit or avoid alcohol. Tobacco use. Smoking and oral use of tobacco have been associated with gastritis. And avoid NSAIDs, such as Tylenol. You can be addicted to Tylenol. I've seen one person ever come in and be actually addicted to Tylenol. And it was very weird. Because usually it's,
just who almost comes out at the very end of this fight with a few more kills. He had just gotten a pentakill before this. It really looked like C9 was in charge. That's something that I credit River
they
highly
played the
for.
replay on fast forward.
Really great job
Usually
in that
it's
game.
like
We'll see if he can
opioids,
do it on the trundle with this 100 Thieves composition
but this guy
as
was
we
like,
take it
nah,
away, Flowers.
fucking acetaminophen for me. Anyway, we're on quiz question. Oh, well. Case study number 4, quiz question number 5. Let's bring this back up. So, case study number 4. Pay attention. The stomach flu is a prevalent... Sorry. Ooh, are people here?
And at the same time, Dignitas is coming off of a really impressive performance of their own just last week.
Yeah, doesn't that just seem
Oh, I do
absurd
hear people here.
that 100
Well,
Thieves would be
this might
in
be the end of
first